Welcome to Health Diary. We're coming to you from 4 Points by Sheraton right here in Hurlingham. My name is Winnie Lubembe. Now, in a world where people are often judged based on, among other things, their appearance, people with acne often face social stigma. However, studies have shown that acne is more than just skin. It disrupts your sleep and your general well-being. So then how do you tackle this? How do you get the best treatment? We find out, but first things first, the fact of the matter. Acne is a common skin condition involving blockage and/or inflammation of hair follicles and their accompanying sebaceous gland. The most common spots for breakouts are the face, chest, shoulders, and back. Although mild acne may improve with over-the-counter treatments, more severe forms should be treated by a dermatologist.
Before 2020, I had acne. I think at my adolescence, when I was young, I had acne around, I think in 2006, back then, and it was bad acne, but at that time, I've never visited dermatologist. But now with the recent acne, it was in 2020, around April. It was really, really, really bad. So to have bad skin is not something that anyone, I think, will ever enjoy. Even talking to someone direct on your face, it was really hard for me to do something like that. It was very itchy. I couldn't even wash my face. When I bow down like this to try and wash my face, I feel really, really, really painful. So I decided to do a self-medication, which later I realized it was the worst mistake that I did, and it made even this acne became even worse. That's when I decided, let me go and see the dermatologist. So when I went there, he did a blood test, and I was told that I was having high bad cholesterol. I was put on a raw acne, that is oral medication. So for that medication, it went for like 3 months. Right now, I feel good. I feel nice, yeah. So right now, honestly, I can face anyone.
I was diagnosed with acne when Corona started, when we were introduced to the new thing of masks. Acne really affected my self-esteem because I never used to take pictures. I had tried all the things, you go to the beauty products, you purchase this one, you purchase the other one, thinking it's going to work, but it never worked. So I decided to go and see a dermatologist. The treatment that I was given was oral, and at the same time, something to apply, a cream to apply on my skin. I'm happy, actually, since my skin cleared. I don't have to use makeup. Just wake up, wash your face, and maybe do the facial routine. I can tell them is go to a dermatologist, because if you self-medicate yourself, it becomes worse, because sometimes you don't even know the products that you're using, whether they are for sensitive, dry skin, oily skin, but a dermatologist will guide you the best way forward.
All right, now let's get to understand more about acne. And today, to help us with the discussion, is Dr. Hashim Shokatali Kadabai. I say that right?
Perfect.
Right? Thank you very much for joining us today. He is a dermatologist and venerologist. The name, okay? And then we also have Miano Mushiri, who had acne, and he is doing better right now. Thank you very much for coming by today and sharing your story. You know, most of the time when we talk about acne, it's usually acne and women. But today, to get, perspective from a man, that's really, really good. So thank you. Thank you for your time. Now, Dr. Hashim, let's start with you. Acne. What is it? And do we have like different types of acne?
All right, so in basic terms, acne is just an inflammatory disorder that happens on your pilosebaceous unit, which is basically your sebaceous gland and your hair follicle. So whenever you have inflammation of that particular unit, that's when you start calling it as acne. But it's not just as simple as inflammation. There's definitely other things, which is like follicular plugging, which is going on. So when you're looking at acne itself, when you look at the types of acne, the acne vulgaris is basically the commonest type, and everyone generally has it. But then we do have like really severe types of acne, which is like nodulocystic type of acne, or even acne fulminans, which actually makes it really, really nasty for patients.
For you, Miano, you, of course, you were diagnosed, you had acne, right? What type of acne was that?
Cystic. Is it cystic?
Cystic
Yeah,
acne?
cystic acne.
Cystic acne.
Cystic acne,
Okay.
yes.
But the problem is I actually didn't treat it properly because I wasn't consistent.
When did it come about, and do you know what caused it?
So I'm not too sure what caused it. You know, I think Doc can help me, but I do know I have very oily skin. You know, it's about Feb last year, so maybe a year ago. And you know, obviously the struggles with, you know, trying to fix it, trying to take all sorts of things that are not prescribed, and you know, different soaps, different gels, trying to wash your face with different things, trying to apply different things, and I mean, it's never going to work until you see a doctor, you know, especially for acne.
Yeah. All right. And Dr. Hashim, cystic acne.
Yeah.
What is it?
It's really painful, it's aggressive, and it's actually something that as soon as you see your face in your morning, you're like, oh my God, what's happening, you know? Generally with men, they tentatively do delay treatment, especially because, you know, the way we have been built as men, you know, you're like, I'll fight it out, it might just go away, things like that. But the problem with the nodulocystic acne is it gets worse and worse and worse with time. So you see the oozing gets worse, the pus gets worse, and that's why you see like, then you're just like, enough is enough, I just need to see a doctor. Now, generally that's unfortunate misconception that we have that all doctors are expensive. Unfortunately, you must have definitely spent more
On
trying different products
right?
actually than getting a professional opinion. It's not doctors expensive. You need to get the right treatment. So that's why I generally go to someone who's a professional, especially a dermatologist, to actually try and get you that treatment.
So is it like you took a while before you sought help, right?
I mean, it's a year after. So after,
A year after.
So after I tried the first set of meds, I kind of just went off. Just let it go again. And then I kind of was like, you know, let's just ride this thing. You know, let me go and see this doc. And, you know, as you said, there are very few dermatologists and they know what they're doing.
Exactly.
Side effects are killing. You know, I mean, dry lips, dry eyes, dry skin, headaches, pains. I mean, and this is on the daily.
So paint a picture for us of how you looked like with that particular type of acne.
Oh, it was, as you said, you know, there's a social stigma. It's that where there's one day you wake up and you're like, actually, thank God we're wearing masks. Because it's actually like awful. You know, you've got all sorts of, you know, big red dots on your face in places, you know, where they're probably not even supposed to be. But, you know, apart from that, it's, you know, it's itchy, it's, you know, you scratch one and that's it. You know, it's bleeding the whole day, and it's just that horrible feeling where the whole day is actually just based on your face. So you're not even concentrating on what you're supposed to do. So it now starts becoming an issue with your health. Yeah, self-esteem, your mental health and stuff. So it kind of start going down. And you kind of also don't want to talk to anyone about it, and that's how guys are about it. So, and then it's just like, you know, slowly deteriorating. So it's pretty hard. It's pretty hard.
Yes. Now, Dr. Hashim, then what causes it? Because Miano says, I have oily skin. And I know this is something that most women say, I have oily skin, so that means maybe,
So this is, again,
we tend to diagnose ourselves.
That's the main problem. But if you look at it, is it your face that's oily or the rest of your skin as well that's oily? All right? Most of the time you'll feel that it's just the face that's oily, the rest of the skin is super dry. All right? So it's more of an imbalance of the skin. All right? Whenever you have acne, one thing that is really causing the acne is not just the bacteria, but the excessive sebum production. And sebum production happens when your brain naturally is feeling that your skin is dry. Unfortunately, what people don't realize is that the skin itself is about 4 meters squared. The face itself is a very small component of it, and that's where basically all the sebaceous glands are, which actually increase the amount of oils. You do have them, the rest of them on the body, but generally the higher the concentration is over the face, the chest, and the back, and that's where the acne generally do tend to occur. So a lot of times what happens is that, you see, you're kind of not even using the right products initially, because people are like, I have an oily skin, that kind of thing. So you're already using something that's for the face, yes, but you're not taking care of the rest of the body. The second thing is the hair. You see, generally our head is round, so whatever is on top of our head naturally trickles onto the face as well. So hair care and skin care both additionally help with acne care. So that's where a lot of times we actually tend to forget. Now, acne vulgaris generally is more of bacterial inflammation, but nodulocystic is where the inflammation is excessive. Your body hits it really hard, so you have that severe inflammation that's occurring, and that's why it's so cystic. It's so painful. What happens is that you tend to listen to your best friends, tend to listen to people you trust. All right, so they'll be like, this worked for me. Yeah. Why don't you try it? But they don't realize the skin is very different. Yeah, even with sisters, it's very different. So one thing that we've realized is that people will just put it as creams. What is in those creams is important as well, because most of the times you need an antibacterial, you need a retinoid. Those are active ingredients that actually help with the acne. Now, those are prescription medications. Unfortunately, in Kenya, what we do is we just go to the pharmacy,
yeah.
So
yes. It's the easiest thing.
Yes.
So then the pharmacist is like, here, tatizo chukua yoda.
Yes.
And then you have no idea how to use it, one, how much to apply, where exactly you're putting it. Because you see, for everyone, cream is like a lotion, so you just apply it over the entire face.
Okay, all right. So 1 year on soaps, on medication, did it make it worse? Did it help in, even if it's like the tiniest bit?
I feel, so I went to see, I think, Dr. Rup Saini, and I think the first thing she said to me is like, first of all, welcome back. And I kind of run away from her.
Oh.
And she's like, are we going to do this properly? And the first thing I did is blood tests, because then you start checking your blood for all sorts of things, anything you could be allergic to. And that was the first thing we did. And then she said, okay, you've got to do it like this, that. In about 2 weeks, I saw, a massive difference.
Oh, wow.
And it's consistency at the end of the day.
All right, Dr. Hashim, very briefly, could you just take us through why it's important to do like blood tests?
So generally, the main reason why you do the blood test is not for the type of acne, it's to actually start the medications on. Some of the medications have really nasty side effects, unfortunately, on your liver, on your kidneys. So we need to make sure all these tests are normal before we do start some medications. Sometimes it also depends on what exactly type of acne it is. So depending on what you present with, then we do something like that.
All right, so let's take a break. But of course, when we come back, we'd also want to understand the cosmetic acne, which I'm pretty sure so many women are like, maybe, all right? And of course, we'd also want to understand from Miano, how bad did it get? And especially when it comes to like, mental health, because like he said, you really go down and your self-esteem actually goes down. So how was he able to overcome that? We talk about that after the short break. Stay with us. All right, welcome back. Glad you're still with us. The show is Health Diary, and today it's all about acne. So to help us with the discussion is Dr. Hashim Shokatali Kadabai, who is a dermatologist from MP Shah, and also Miano Mushiri, who again suffered from acne and is doing much better right now, and is here to help us, and just share his story as far as acne is concerned. So Dr. Hashim, cosmetic acne. All right. And I'm pretty sure there's also someone who's like, by the way, is acne somewhat genetic?
Okay, so this is totally two different things.
Yes.
So as acne cosmetica is where the cosmetic type of acne, which is related to what you apply on the face, what products you're using. So generally, most of the products are what we call water-based products. So they don't really clog the pore of acne, and hence doesn't really cause the acne itself. Unfortunately, there are other oil-based makeups, really thick makeups that actually clog the pores. And when they clog the pores, actually allow that collection of the bacteria, the sebum and everything, and that's what basically ball rolls the acne to start.
Okay, all right. So Miano, what did it do to you as far as self-image?
I think towards the end of the year, it's, people always saying, what's happening with your face? Because you see, that's actually the conversation someone will always say, because they'll see your face first and they'll be like, what's going on? What are you doing? And especially, and people close to you, because, you know, it gets down to your family, because those are people that continuously see you, or your friends and all that. So it starts to become a thing you start questioning in your head. You know, it's like, what is this thing that's eating me alive? And it's the encouragement that I think we need to do for each other. It's actually saying to your friend, let me go with you, let me help you. You know, don't say what is wrong with you, or why you know what I mean?
True.
You have to change the conversation. You have to change how you approach the situation. And it's the confidence that we install in each other that will now, you know, help us to deal with the issues.
All right, Dr. Hashim, then how bad can it get? And especially either delayed treatment or just not seeking treatment at all?
Most of the cases are mild to moderate. Some of them are severe, like our friend here. But generally, it's the men who tentatively come when it's moderate to severe. The ladies come when it's mild to moderate as well.
So you talked about getting the right type of treatment, right, for acne. Let's talk first of all, diagnosis. What do? Should you seek help once maybe the acne is there, or should you seek help just in general, get to understand your skin type, so that that influences the kind of product that you use?
Yes, you know, when you do have a better understanding of what your skin type is, what your flaws are, where exactly the problems are, what pigmentation challenges that may occur, then you definitely be seeking better types of medication, better types of products, better types of routines that would actually improve your skin in general. So that would come under the anti-aging as well, because then the earlier you have your products in terms of what works for you, the better your skin, the better you look as you grow older. But when it comes to acne itself, generally what I tell patients is that you will see your face yourself. When you see that it's not getting better, you've tried at least just a basic soap, it's not getting better, don't wait. Just come over. It's easier for us to know what type of acne it is, because currently a lot of patients are developing mask acne, which is just because of the type of mask they've been wearing. So you see, they haven't had acne the rest of their life, yes. But then just because of wearing the mask wrong or removing the mask wrong, because most of us just flip it off, that mechanical abrasion actually causes the acne itself.
So then when it comes to diagnose, what are some of the steps that are taken to ascertain what kind of acne this is? Or first of all, if it's acne or something else?
So generally, the first thing you'd have is a conversation with the patient. It's what we call history taking. And the history itself would identify the type of acne the patient has been suffering from. From there, we come to the examination. We have a very good lens. We check through the whole entire face. We see what exactly is the problem. And then from there, we come up with a treatment strategy. Each individualized patient has one particular strategy. So we'd see what exactly works for you and then start with that particular basics, then move on. And like we said, it's maintenance. So you can't just say that I came once and then I call you back in a review for 3 weeks and then you've decided no.
Yeah.
Right? So you have to be specific for that patient. For example, like even like the way you said genetics, right? So some people would have that predisposition, but it may be that it's something the entire family is doing wrong. All right? For example, maybe touching the face. That's something which people just learn by looking at each other. The more you touch the face, the more the acne gets there. So that kind of tics, or what we say habits, sometimes may run in families, but it's not, it's a genetic problem. Yeah. But we do have genetic predispositions, yes.
All right. Okay. So may I know, in terms of the change, because like you said, once you got the right diagnosis first of all, and then you were put on the right treatment, you started noticing changes in what, 2 weeks?
Obviously, these changes, you know, they come with also changing, you know, a bit of the lifestyle as well, you know. But it's also about learning, you know, small habits like, you know, touching your face and all that. I cannot stop. It gets very itchy, and those are kind of the side effects. But in 2 weeks, you know, I was going to give up in 1 week because the side effects, I mean, are treacherous.
So what are some of the changes that you had to make? Like, did you have to have like a routine in terms of you?
So, yeah, well, I mean, you're spending maybe more, I spend a lot of time being specific now, you know. I spend 20 more minutes, and, you know, get out the shower, wash my face. Even the way I put, you know, what do I put first? Is it my facial cream before my body lotion? You know, it's very specific. it's very thought through. How do I apply it?
Exactly.
Where do I apply it? What type of lighting am I using? And so for a guy, you know, it's a complete
Yes.
different ballgame. So
But we
then,
try
you know,
to make it
another
as
day.
simple as possible.
Right.
You see, I mean, like, we don't give it like the 7-step routine
Yes.
which ladies
Like
want to follow.
wash, tone.
So it's a basic routine which you generally be very comfortable following. Yes, you'll be definitely spending more time, but it's specific for that type of problem.
Okay. Take us through the routine.
So generally a basic routine is cleanse, moisturize, and sunscreen if you're having a good face. But if you have acne, one thing that you really have to stop is touching the face.
Absolutely.
All right, so one, touching the face is one. Second, how to wash the face. You see, we always try to move from the cleaner areas then to the dirty areas generally. The way you wash, the time you take to wash. You see, it's a process of at least about 2 minutes to wash the face, not just rubbing it and then expecting to get better. Application as well, it's spreading the medication, not rubbing
Not
it in.
rubbing,
You see,
yes.
and the concentration, like the medications you've been told, it's a pea-size amount. Then you don't come and tell me, I've been using a finger daktari because this pea-size is very
Yes.
difficult to follow,
Yes.
right? I gave you specific instructions, use this much,
Yes.
yeah? Not that, nikitumia dawa nyingi
Intapona
pona raha.
haraka. There's that part.
That's the
There's that
problem,
part,
right?
Yes.
So unfortunately, that process itself takes time for you to get that in ABC kind of way. So it will take some time, but once you're doing it, you'll be doing it with your eyes closed.
Yeah, and listening to you say, there's usually like a process when you have like a good skin. You wash, you moisturize, you sunscreen. That sunscreen part is where not everybody does that. If anything, people are like, Sissy, as our skin, we're not affected by sunscreen.
That's the
at
problem.
any
But the
given
problem
point.
is no one is realizing the ozone is getting depleted. We need to now supplement with sunscreen. All right? Now, with sunscreen, one thing what people will always follow is if you tell them it's anti-aging. And that's one
That is
very
where
important factor.
yes.
So photo-aging is a very, very large component of UV radiation. And sunscreen is a really, really important component. But unfortunately, what people try and do is they use very thick sunscreens on their face, which actually clogs the acne and then makes it worse.
That's the thing.
And usually water-based sunscreens are very important. So I would always say late 20s, early 30s, you should be on sunscreen.
There's something that a lot of people say that is hormonal acne, right? First of all, is there something like hormonal acne, and what is the treatment process for the same?
Hormonal types of acne are what we call syndromic, or where they actually increase the androgen, which is basically something that stimulates the sebum production. All right, and it's mostly seen in something called polycystic ovarian syndrome. But then it's not just acne that they are one, because they will have other symptoms of the disease as well. So you see, what people don't realize is that during your period time, you have an increase in oil buildup. It'll be natural, because that's when your body systems are actually increasing the sebum production to cater for that particular period. So when you have increased amount of oil production, it's naturally going to cause a little bit of clogging around the face, which then leads to the acne, one or two of them. But let's say, for example, now the entire face is getting really problematic, then we definitely do some hormonal tests to actually check that out, because then there will be something specific.
Okay, about this thing.
Exactly.
Okay, so Miano, very briefly, you've been there, you have seen what it is to have acne, and you're here now. So to all the people who are watching you, both men and women really, what would you tell them as far as acne and just seeking the right treatment?
Don't let anyone say or do anything for you to kind of be discouraged of what's happening. And secondly, as Doc had said earlier, is go see a doctor, as soon as you can.
And then Dr. Hashim, what is your clarion call number one to people watching us right now, and number two to insurance companies? Should it be covered by NHF? Because Miano says, the treatment is quite expensive.
My slogan is love your skin. All right, love yourself first. Try and seek the best for your skin. All right, a skin is an investment. All right, it's something that will represent you for the next 80, 90, 100 years. That's one. Number two, generally for our, what we call the insurance companies, people who pay cash, people who generally have other people supporting them, don't worry about the treatment. All right, there is always treatment that is tailor-made for yourself. So what is you can afford, that's what would give you. acne is maintenance treatment, all right? It's something that is affordable, something that the insurance definitely also gives. Most of the insurance companies treat or cater for acne medications throughout your treatment.
Thank you very much to both of you for coming by today. Miano Mushiri, acne patient, but of course, you're better now. I do not want to stress on patient. You're better now. And of course, Dr. Hashim Shokatali Kadbai, dermatologist from MP Shah Hospital. Thank you very much as well for all the insights, really, as far as acne is concerned. And now we'll leave you with this health tip.
I'm going to show you how to tone your biceps. Bicep, this muscle here. What we are going to do is called the Barbell Curl. Hold it this way, bend your knees slightly, put your chest out, and then you take it slowly from down, up towards your chest, then back down, up, and make sure it's only the arms that moves. You go for many repetitions. That will help you burn the fats. The lighter weight is the one you can use for many repetitions. We also have biceps with the dumbbells. Dumbbells are these ones. This is the move. Take it this way. It's like you're doing forearm, then you turn. That one will go for the biceps. All right? Same to this side. So you can alternate it. You can alternate it. And remember the counts. Many repetitions will help you burn and tone more.
What an insightful conversation we had today right here on Health Diary as far as acne is concerned. And takeaway message is you need to seek the right treatment. We have to end it here. My name is Winnie Lubembe, and a special thanks to 4 Points by Sheraton for hosting us. If you have any other question in relation to acne, feel free to reach out to us on our social media platforms. But until then, adios.